Welcome back to Med School Radio, and we are taking a look at another USMLE review, this time mixed subjects, looking at some of the key banks and just basic summaries. If you really want to get a feel for the questions, you have to look at the original questions, but these are just the summaries. Okay, let's get started with a question regarding the maxillary sinuses. Blunt trauma to the globe can cause orbital blowout fractures. These fractures most commonly involve the medial or inferior orbital walls due to the thin bone bordering the ethmoid and maxillary sinuses. The medial femoral circumflex artery and its branches provide the majority of the blood supply to the femoral head and neck. Injury to these vessels due to a displaced femoral neck fracture can cause osteonecrosis of the femoral head. So remember the medial femoral circumflex artery. The hypothalamus is a key region responsible for homeostasis. The ventromedial nucleus mediates satiety. Lesions of this area of the hypothalamus can result in hyperphagia and obesity. The optimal location for needle insertion during a lumbar puncture is the L3, L4, or L4, L5 space, as this is well below the spinal cord termination site, which is L1 in adults. The L4 vertebral body lies on a line drawn between the highest points of the iliac crests. Injury to Meyer's loop in the temporal lobe results in contralateral superior quadrantanopia. Spinal stenosis occurs most commonly in the lumbar region and presents with posture-dependent lower extremity pain, numbness, paresthesia, and weakness. The most common cause is degenerative arthritis of the spine, which results in narrowing of the spinal canal due to intervertebral disc herniation, ligamentum flavum hypertrophy, and osteophyte formation affecting the facet joints. The piriformis passes through the greater sciatic foramen and is involved with external hip rotation. Muscle injury or hypertrophy can compress the sciatic nerve in the foramen, causing piriformis syndrome. The esophagus is located between the trachea and the vertebral bodies in the superior thorax. It is typically collapsed with no visible lumen on CT images of the chest. Irritation of the parietal pleura will cause sharp pain, which is worse on inspiration. Pain arising from the mediastinal or diaphragmatic pleura will be carried by the phrenic nerve and referred to the C3, C5 distribution. The ureters pass posterior to the ovarian or gonadal vessels within the retroperitoneum and cross anterior to the common external iliac arteries to reach the true pelvis. Within the true pelvis, the ureters lie anterior to the internal iliac artery and posterior to the uterine artery. We've gone over this before, but it's good to look at it again. Direct inguinal hernias occur most commonly in older men due to weakness of the transversalis fascia. They protrude medial to the inferior epigastric vessels into the Hasselbalch triangle and pass only through the superficial inguinal ring with no direct route to the scrotum. Carpal tunnel syndrome occurs due to compression and/or inflammation of the median nerve in the carpal tunnel and typically results in sensory loss over the palm and anterior aspect of the first 3.5 digits, with thenar atrophy and impairment of thumb flexion or opposition. In the forearm, the median nerve courses between the humeral and ulnar heads of the pronator teres muscle and between the flexor digitorum superficialis and flexor digitorum profundus muscles. Due to gravity, supine patients typically aspirate into the posterior segments of the upper lobes and superior segments of the lower lobes. Patients who are upright tend to aspirate into the basilar segments of the lower lobes. Aspirated material is more likely to travel down the right main bronchus. The anterior cerebral artery, or ACA, supplies the medial aspects of the frontal and parietal lobes, which contain the upper motor neurons responsible for contralateral lower extremity motor control. Thromboembolic occlusion of the ACA characteristically results in contralateral lower extremity weakness with hyperreflexia. Patellar fractures are most commonly due to a direct impact on the anterior aspect of the knee. Signs include an acutely swollen knee, focal patellar tenderness, inability to extend the knee against gravity, and a palpable gap in the extensor mechanism. Infarcts involving the anterior portion of the medial pons can produce dysarthria and contralateral hemiparesis or lower facial palsy due to disruption of the ipsilateral corticospinal and corticobulbar tracts. The trigeminal nerve arises at the level of the middle cerebellar peduncle at the lateral aspect of the mid-pons. The Valsalva maneuver increases vagal tone and can be used to abolish paroxysmal supraventricular tachycardia. The rectus abdominis is the most important muscle in achieving the increased intra-abdominal and intrathoracic pressure of the Valsalva maneuver. The left ventricle forms the apex of the heart and can reach as far as the fifth intercostal space at the left midclavicular line, or MCL. All other chambers of the heart lie medial to the left MCL. The lungs overlap much of the anterior surface of the heart. The hindgut encompasses the distal 1/3 of the transverse colon, the descending colon, the sigmoid colon, and the rectum. These structures receive their main arterial blood supply from the inferior mesenteric artery. Damage to the left temporal hemiretina will disrupt the transmission of visual information along the ipsilateral optic nerve, lateral optic chiasm, optic tract, lateral geniculate body, optic radiations, and primary visual cortex. Thoracic outlet syndrome is most often caused by compression of the brachial plexus as it passes through the scalene triangle, the space bordered by the anterior and middle scalene muscles and the first rib. Symptoms typically include upper extremity numbness, tingling, and weakness that worsen with repetitive overhead arm movements. The presence of an anomalous cervical rib is a risk factor for thoracic outlet syndrome. Any abdominal process, for example ruptured spleen, peritonitis, hemoperitoneum, Irritating the phrenic nerve sensory fibers around the diaphragm can cause referred pain to the C3-C5 shoulder region, which is called the care sign.